Hello everyone, welcome back to our channel. In our last video in OET reading, we have learned about the tips and tricks how to handle part A, part B and part C in OET reading exam, right? So we are going to deal with examples and how to apply those strategies to derive the answer. Are you ready? Let's start with example number 1. So this is an example for part A. Let me read it for you. If you want, you can just pause the video and read it by yourself. I will also read it for you. Before your surgery, it is crucial to prepare your body properly. This involves stopping certain activities that could interfere with the anesthetic process. You should avoid eating for at least 12 hours prior to the procedure. Additionally, it is essential to avoid drinking alcohol for 24 hours before the surgery to ensure your liver can properly metabolize the anesthesia and avoid complications. Smoking is also advised against for the same reason. While these steps might seem inconvenient, they are vital to ensure the best outcome for your procedure and recovery. So, this is an excerpt for part A. And let's see the questions. So the question here is, what should patients avoid before their procedure? Eating and smoking, drinking alcohol and eating, drinking alcohol and smoking, taking medication and eating. So now, here's how you are going to tackle this. First, you need to skim the text in order to get the general idea. So you will quickly notice avoid drinking alcohol is mentioned, right? Which helps you focus on finding alcohol as the key issue. Now you can scan through for any other activities in order to avoid. It's mentioned that eating and smoking should also be avoided. So, what is the answer here? If you see the answer, answer C is the right option. Drinking, alcohol, and smoking. And you also use the elimination technique by removing answers like taking medication or eating and smoking. None of these are mentioned as directly as alcohol and smoking. If you see for drinking alcohol and smoking, that is mentioned directly in the text, in the passage, right? If you want, you can just move back, you can go back and look for the passage. That is the only option mentioned directly. But if you see for eating and smoking or taking medication and eating, that was not mentioned directly. Got it? So, this is how you have to skim and scan through the passage in order to get the right option. Now, let's move on to our next example. This is an excerpt for part B. So, let me read it for you. Recent studies on hypertension treatment have led to promising new approaches. In a comprehensive study involving over 1,000 participants, patients who were administered the latest hypertension drug showed a 20% improvement in managing their blood pressure compared to those who were prescribed traditional treatments. However, the study also revealed a significant limitation. Participants with pre existing conditions such as diabetes or kidney disease did not show the same level of improvement. In fact, many of these patients experienced little to no benefit from the new drug. The research suggests that while the drug is effective in healthy individuals, its success may be limited for patients with complex medical histories. Now, let's move on to the question. The question given here is, what was the key finding of the study? And the options given here are the new drug worked well for all patients. Patients with pre existing conditions experienced no significant improvement. The drug was only effective for patients with hypertension, and the drug showed adverse reactions for all patients with pre existing conditions. Now, in order to handle this part B, you need to carefully read and focus on key details. Okay, let me show you how the text emphasizes that the new drug works well for many patients, right? If you see here, it works well for many patients, right? Latest hypertension drug showed a 20% improvement in managing their blood pressure compared to those who were prescribed traditional treatments, right? Here, it also mentioned as it fails for those with pre-existing conditions such as diabetes or kidney disease. This is very crucial. So, if you look for the options, answer B is the correct answer. Okay, patients with pre-existing conditions experienced no significant improvement because the study focuses on the limitation for certain groups of patients, not the overall effectiveness, right? So if you see the question, what was the key finding of the study? It focuses on the limitation for certain groups of patients. So answer B is the correct answer. So you have to make sure to read past the general statements and focus on what is specifically mentioned about different patient groups. Now let's move on to another example, part C. Here is the text excerpt. A groundbreaking study conducted by researchers at the Institute of Neurology explored the effects of a new cognitive enhancement drug aimed at improving memory retention in elderly patients with early stage Alzheimer's disease. The trial, which spanned over 18 months, involved 400 participants. The results indicated that the drug improved memory function by 25% on average, as measured by standardized cognitive tests. However, the study also uncovered some troubling side effects, including increased anxiety and disorientation in a small subgroup of patients. In addition, the drug was less effective for patients who had a history of depression or other mental health conditions, leading researchers to caution against its use in these individuals. Despite the promising results for some, the research concluded that the drug's overall effectiveness remains variable, and it is important to carefully assess each patient's medical history before considering the drug as a treatment option. So now let's look for the question. If you want to read the text by yourself, you can just, go back and you can pause the video, read it by yourself, understand the text, and then you can come back to the question. The question here is, what did the study conclude about the new drug? And the options are, it was effective for all elderly patients with Alzheimer's disease. The drug showed promising results for some patients, but it was less effective for others. The drug caused serious side effects for all patients. It was equally effective for patients with and without mental health conditions. So, what is the right option? First, in part C, you need to focus on reading critically and analyzing the big picture of the study. Remember that this text tells us that the drug was effective for some patients, improving memory function 25% on average. But there were also negative side effects, right? Increased anxiety and disorientation in a small subgroup of patients. And more importantly, the drug was less effective for patients with mental health conditions like depression, which makes it clear that the drug's effectiveness depends on the individual's health history, right? So, if you look for the option, the answer B. The drug showed promising results for some patients, but it was less effective for others. That's the correct answer. Okay, so how the question is asking for an overall conclusion about the drug's effectiveness. You need to look for that. What does the question is all about? It is asking for the drug's overall effectiveness, the study conclusion, right? So not just the positive results. When reading for part C, you need to make sure to balance the positive and negative outcomes and look for nuances in the conclusion. Got it? And that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.